Okay, hi everybody. Tonight we are excited to have another 4-H Interviews with Pros, and we have Dr. Christy Rogers, a doctor of physical therapy from McCady Hospital. Christy is also a Utah 4-H alumni, and interviewing her tonight we have Cooper Springer, a 4-H teen leader from Piute County who participates in 4-H shooting sports. Cooper, I'm going to turn the time over to you.
All right. Okay. Thank you, Kelsey. And thank you, Dr. Rogers, for coming and letting us interview you. I'm pretty excited. It's all right if I call you Christy?
Yes.
Is it all right? All right. Thank you. Okay, so could you tell us one quick thing? Tell us a little bit about what you do as a physical therapist and kind of what's a typical day throughout work and things.
Yeah. So there is lots of different ways that you can, lots of different places that you can work as a physical therapist. So I currently work at a hospital in an acute care setting. So a typical day for me, I work in the ICU. So I help patients that are on breathing tubes, on ventilators, and that are critically ill, learn how to move again. A lot of times they've been, paralyzed in the bed for a long time, or just been really sick in the bed and haven't been able to move, and so they get really weak. And so I help them learn from kind of the basics. Like if you think like a baby learning how to move again, I kind of start at the basics of sitting, lifting your head up, and learning how to keep your balance, and then progressing to standing and walking and things like that. So that's a typical day for me. So I am in the hospital, go into the patient's rooms, and work with them to get them stronger. But like I said, there's lots of different ways. When you think of a physical therapist, you typically think of a therapist who is at a clinic, like a private practice or kind of a hospital-based outpatient orthopedic clinic is what your typical physical therapist is. And so the ones that work with you after total knees and total hip replacements or shoulder injuries or ACL tears, things like that. So that's kind of what I would say what most people think of when they think of a physical therapist. And then there's also working with like neurological patients, which is something that I'm very passionate about as well. So working with people after they've sustained a stroke or a traumatic brain injury or a spinal cord injury. And a lot of times you can do that inpatient and outpatient, and do that. And that's something that I love, because the brain is fascinating. And I think it's just so cool how it can rewire itself and like learn how to move again after something so traumatic like that. And probably the last main area of physical therapy is working with kids in pediatrics, people that are born with disabilities or developmentally delayed, teaching them how to do their motor skills for the very first time. So teaching them how to crawl and to walk and move and all those things. So those are kind of the main areas of physical therapy. Hopefully that answers your question.
Yeah, thank you. I think that sounds pretty cool. I bet it's pretty cool to see them when they fully recover, and just because you know where they were and how far they've come and everything. I think that's way cool.
Mm-hmm.
Okay, so what makes you excited about your job? What got you into it?
So what gets me excited now, is exactly what you just said. I work at McCady Hospital up in Ogden, Utah, and the inpatient rehab facility is in the same location where we do all of our documenting. And so I get to see people from, when they're learning how to lift their head up for the first time to when they're walking and doing stairs and learning how to do their high level activities again. And so I've been able to work with them through that whole process, and and a lot of times they don't remember me because they were out of it and ICU delirium and stuff. And so I can kind of reintroduce myself later on in the process and tell them, give them hope, because a lot of times they'll get frustrated in rehab and just be like, oh, I wish I was better. I wish I was home. And they can be like, well, look what you just did today. Like, you were 2 weeks ago, you couldn't even lift your head up. And so that's something that really gets me excited, is to give hope back to people, give hope back to them that they can return back to their life. Another thing that I love is being able to help people help themselves. Physical therapy is something that you have to do. So it's not a quick fix. It's not something that is fun all the time. We get the nickname pain and torturer all the time, which I try really hard not to be that, but I love that it requires effort, because it's something that if they learn how to do their exercises and learn how to work hard, that they can continue to progress long past working with me as a physical therapist. I feel like I can give back to them more and teaching them how to help themselves.
That's really awesome. We had a bull rider come to our school I think it was a year ago, that had to go through that stuff, and he said that it was a real amazing experience for him, and he was very grateful for his doctors and the physical therapists that helped him. But thinking back, do you notice any interests you had as a youth that align with your current career today?
Yeah. So one thing, a lot of you may know my mom, Jolene Bunnell, and she was amazing, and I love her. But she has migraines, and so whenever she would have a really horrible migraine, I would be able to massage. She had a couple knots in her back. I'd be able to massage those spots out in her back to help relieve her migraine. And it was like magic sometimes. Like, you can feel the knot underneath your finger and you can feel it melt away, and her headache just like melts away. And it was just the coolest thing for me to be able to heal with my hands. And I loved that. I thought that was so cool. Also, I love serving people and helping people. Learned that through 4-H. I love to help and serve people and love people in general. And physical therapy was definitely something that I get to interact with people every single day and hear their stories, and to serve them and to help them, like I said, help them help themselves. And so I think both of those backgrounds really helped me. And I loved the body and how the miracle that the human body is to heal itself. And I didn't want to do like needles and blood and medicine and stuff. Didn't want to give pills that could kill somebody. So physical therapy was a great kind of more holistic option, without all the blood and scary stuff. So
That's awesome. Yeah, I get migraines too, and so like when I'll get them and stuff, if I start getting them a little consistently, I'll be like, oh, my back's out. I gotta go get it adjusted or something like that. But yeah. So what type of education and training prepared you to be a physical therapist?
Great. So to become a doctor of physical therapy, which is what the degree is now, you have to, it's a 4-year bachelor degree that you can do in anything, kind of like med school. You can do your bachelor's degree in anything. And I did mine in pre-physical therapy because I liked the classes, and it was the most streamlined way to get all of my prerequisites done for physical therapy school. So I did that at Utah State University, go Aggies, and it was great, loved it. And the program there was pretty much set up to get all of your prerequisites for the University of Utah. And then all the other schools that you wanted to apply to, I just had to make sure that I took those prerequisites as well. Most of them overlap, but there's some that are a little off. So like a first aid class here, or something like that, medical terminology class there. So just making sure that you look at all the prerequisites for the schools that you want to apply for and kind of plan that out, so you don't end up graduating and then realize, oh, I need this one class like medical terminology, and that will prevent you from applying to that school. So that was something. And then you need to have your what's it called, observation hours, your patient care hours. So I did a lot of observation. You have to do it in different settings. So an inpatient setting, an outpatient setting, working with geriatric patients, working with neurological patients. So making sure that you have your required hours of clinical time for each school that you apply for too. And then PT school. So I did my PT school at the University of Utah, which was a phenomenal program. And in PT school, it's a 3-year, most are about 3 years. Mine was a 3-year degree through the summer, so 9 semesters. And you do your coursework and your clinical hours. So each school kind of works their system a little differently. Some of them are 2.5-year programs, but yeah, so I did, you have 4 different rotations, and I did a lot of them through the University of Utah and IHC, which is where I work now. So
Awesome. I totally agree. Go Aggies. I love the Aggies. Except for maybe when it comes to when they play BYU, I may step to the wise side. But
yeah, that's always the tricky one.
mm-hmm.
Play anybody else then.
Yeah, yep. Okay, what is the average pay for a person in the field of physical therapy, starting versus established, as well as national versus Utah, and as well as, you, of course, you don't have to tell us any of your pay or anything like that.
Yeah. So the range, because yeah, there's the starting pay in Utah is going to be somewhere around 60,000 to 75,000 starting pay, depending on your setting. And then it goes up as you are more established to about 90,000 ish range in Utah. And then going outside of Utah, there also depends on where, I mean, each state is a little different. I know Texas starting can be 80 to 90,000, going up to 100, 120. And I'm not sure too many other states, their average, but I'd say, you know, that 60 to 120 is kind of your good range, starting out on the bottom end, working your way up. There's opportunity to go into business for yourself and open your own clinic. And those, obviously, if it's your own business, you have opportunity to earn more that way. And then hospital settings or skilled nursing facilities usually earn a little bit more. On a salary basis, you make a little bit more in those settings than you would in an outpatient orthopedic clinic if you're not the owner, if you're just a clinical PT. So, yeah.
That's kind of cool. It almost makes sense that you would get paid more in the bigger hospitals and things. But what types of skills are necessary for succeeding as a physical therapist?
Honestly, the biggest skills are your personal relationship skills, your people skills, because we have a student right now that's working with one of our staff therapists, and you just come across so many different people that
Yeah.
it's how to work with people and to come to their level and elevate them from where they are. And I think that that's the biggest thing, is just caring for people and learning how to work with people and how to motivate them to want to do something and want to get better, and how to handle situations when people don't want to work with you, or working with the doctors and communicating and the nurses and coordinating care between everything. One of the main things that I do in the acute care setting is make sure people are safe upon discharge. So planning if they need to go to a skilled nursing facility, or if they need to go to rehab or get home health services, coordinating and managing all of that. I think another big thing is just being comfortable to, touch people, like you're lifting people and working with them. And that's sometimes a big deal for people. They don't want to touch other people. So you have to definitely be comfortable touching other humans. So I always wear gloves, but
Yeah.
it's
I think that would probably be the part for me. I'm okay with helping people if they need it, but I'm not so much of a person that likes to be touched or likes to touch people. I don't know. But so what are some of the biggest challenges that you have faced or are facing as a physical therapist in your field?
good question. So as a global profession, most of the profession, like I said, is in the outpatient setting. And so with COVID, that posed a really big change in everything, with not having patients coming in for a while in the outpatient setting. And so telehealth and working and doing some virtual visits has been a big push, and have been able to get a lot of that approved this year, actually. So that's been really big for our profession. And being able to do I don't think all of your visits would be virtual, but having, some of your follow-up visits being virtual to be able to save on costs and maximize your time. I think that has been a huge thing for our profession this year. And then there's always insurance battles and stuff, working with the different insurance companies, proving that we are necessary, and providing research and documentation of how we prevent readmissions to hospital stays, how we can save a ton on global medical costs, especially with low back pain. So just trying to prove our spot in medical care. And another big thing that Utah is approved in, and most states are coming to this, where you can have direct access to physical therapy, which means you don't have to go see a doctor first, but you can go directly to a physical therapist and be seen that way. So that's something that's still determined by insurances a lot of times, if you need a doctor's note first or not, but that's a big push. And then in the hospital setting, we've been busier than ever this year with COVID. So just trying to manage working with COVID patients in the ICU. I work with COVID patients all the time, and being able to keep myself safe and my family safe, and learning what the best things for COVID is, and trying to learn about this new disease. And so that's been an interesting thing this year for sure.
Yeah, I bet. So what's the most valuable reward you've reaped from this career choice?
Most valuable reward, honestly, I'd say twofold. Number one, the relationships that I have with patients. Working in the ICU, it's a very different setting because sometimes your patients don't get better. And realizing that I might have been the last, helped this person get out of bed for the last time in their life is very humbling. To know that I was able to help them and help relieve some of their pain at the end of their life. And some patients that you wouldn't have even expected to have passed so soon, just being able to develop that relationship with them and to talk with them. Sometimes doctors are in and out so fast and nurses are busy with so many other patients that I get to just talk with them. I have a half an hour or so with them that I can just, we sit on the edge of the bed because that's all they can do. And we just talk, you know, and that is very rewarding to be able to be a part of their life, even if it is for a short time.
Yeah.
And then the next thing that's very rewarding is the people that do get better, and to be able to see them down the road a couple of weeks, or even some of our COVID patients that I was working with in the hospital. They had to go to a different facility for a while and then came back to our rehab, and just to see the night and day difference that they are able to go back to normal functioning lives, or after a stroke or a traumatic brain injury where they were in a coma for so long, or completely changed their whole life, being able to see them get back to a new normal and help them achieve their goals. And I think that is the most rewarding thing.
That's awesome. All right. So, what advice do you have for someone considering a career in physical therapy?
Shadow. Just follow around a physical therapist, because that's what I did in college. I honestly, I chose the degree because I liked the classes, and I was like, sure, that sounds like fun. But I didn't know if I really wanted to go to PT school, because that's a commitment. 3 years, lots of
Yeah.
loans, lots of debt. You know, it's a big
Yeah.
commitment. So I wasn't sure if that was the path that I wanted to do until I started following around and doing those clinical hours and shadowing. And the more I learned about the profession, the more I liked it. And the more you are around it, you can really see if this is a good fit for you. You can like the theory of it, or you can like the pay of it, but really you're not going to get into a physical therapy school if you're only going to do it for money, because they really look for people that want to do this and are interested in being a physical therapist. And if you want to just make a lot of money, there's a lot of other options out there that can make a lot more money. But being a physical therapist, I think just following some PTs around and see the setting that you want to be in, the type of people you want to be around, the type of patients you want to work with, because it can be so broad. I think it's just really important to shadow, just to follow people around and see what you think. So
That's
I'm in an interview zone.
that's awesome. That's way awesome. Yeah, that's I have a lot of friends that have had to go to physical therapists more for sports injuries and stuff. But as well as my dad broke his shoulder, but that's a really amazing job, and we thank you for doing it, and thanks for coming here and letting me interview you and letting us know about your career and job. And I'll turn the time over to you, Kelsey.
Okay, excellent. Thank you so much, Cooper, and thank you, Christy. I appreciate both of you. We did have a question in the comments on Facebook. It's actually from Jolene, but Christy, she says it's pretty difficult to be accepted into the PT school. Can you tell us how 4-H helped you with the interview process to get into PT school?
Yes. So yeah, getting into PT school is very difficult, especially the University of Utah. So the first thing to be able to even get an interview, you need to have a good GRE score and have good grades and meet all of the requirements. So you need to make sure that you have your hours, all your prerequisites. So that's the first bar, which a lot of people don't even make it to that point. So
what's GRE? Sorry.
It's your like a kind of like your ACT, but for graduate school. So it's your graduate, I don't even know what it stands for, admissions test. So good question. And then in the interview process, so once you do get an interview, that's a huge accomplishment in itself. And to get what they look for, and I got to actually help do the interviews while I was in physical therapy school. So the things that we look for is, like I said, like good people skills, being able to interact well and problem solve and be solution seeking and patient focused. So 4-H totally helped me in all those things. So I did World of Work contests, practiced a lot of interviews, practiced with my mom, who is like the most critical interview critique out there, which was awesome because it helped. And being able to do I was a state ambassador. And so being able to go through the state ambassador interview process and go through that series of interviews definitely helped me gain that personal confidence in myself to be able to interview in front of like a whole panel of people. So this goes for jobs too. So to get into PT school, there's like 2 or 3 one-on-one interviews that you have, and then a panel interview with other PT students. So they see how you work a problem with other students and being able to, follow and lead. And 4-H taught me all of those things so much, to be able to work with people, how to problem solve, how to solution seek, how to be a team leader and a team follower. So yeah, 4-H was huge because I didn't have the most astounding experience in physical therapy. I did like the bare minimum of hours of observation to get like in the interview, but they liked me and it was a good fit for the team and good fit for the university because of my interviewing. So that's why I got into PT school, and that's why I have the job I have now too, because of the interview, because they want to work with people they like. So be a likable person, and 4-H really helps you be a likable person.
Okay, that's excellent. I appreciate that. And that's such a great answer. I feel like we can really relate to that. Anyone who's had a 4-H experience totally knows what you're talking about. So I appreciate that a lot. Thank you again to both of you. I really appreciate it. We have, just so that all of you know, just like Christy mentioned, USU does have a pre-physical therapy program in their health science department to finish off your degree. And whichever direction you choose to go, you do have to go to a different school, like Christy mentioned earlier as well. But if you're interested in coming to Utah State for that pre-physical therapy degree, it is there. And like Christy said, go Aggies. So let us know if you have any questions related to that. And we appreciate everyone for watching. Thanks so much.